There was one gigantic carrier, prior-auth to 12.3% of PA requests. They all were sort of in the same ballpark, around 12, 13, 14%. There was one that was lower. What was stunning was, upon appeal, 95% or more of these prior-auths were reversed. So you start thinking, and by the way, only 11% of the prior auths were appealed. So it's just like, it does not take a rocket science to understand what the financial incentives are there. Like, everybody knows that nothing gets appealed. Everybody knows that these entities are playing the float, right? Like, so I think that's a perfect example of, you have a patient who was written care, who obviously it was evidence-based if 95% of these are getting through,
yes.
right? Like, upon appeal. And there is a financial incentive to delay.
Yeah, so you're absolutely right. And it's interesting, I've spent many years auditing appeals and grievance files. So this is not a surprise to me, but I think it is a surprise probably to the general population, not only the overturn rates upon appeal, but the low appeal rates. And this is just really sad. When we're thinking about these Medicare beneficiaries, either over 65 or disabled, their provider has requested care, they're denied, and they just don't get the care. And a high percentage rate. And that is terrible, but it's a fact. And so I do strongly believe that there needs to be changes to the system, that access to care and beneficiaries being able to access that care easily needs to be at the forefront of those changes. Because I've just seen so many adverse outcomes, not only with auditing these grievance and appeals file, and a lot of times it's the same beneficiary, so you get a stack like this, so you're seeing what's happened. But then also, even in my own life, how difficult it is to understand the system if you're not somebody like me who's lived in the system for years. It's not simple. It's not a simple process.